everyone, my name is Dr. Charlene Ortiz, and today we are going to start a new lecture. This lecture is going to involve identifying scientific variables. So today we are going to talk about things such as continuous variables. We're going to talk about discrete variables. We're also going to look into the different types of quantitative and qualitative variables, and also these scales of measurement. All these terms, I should say, will make a little bit more sense because I always try to relate that into the field of social sciences. And you're thinking, why do I need to know about these types of measurements? Well, that is because when we are conducting research, one of the things that we need to do is measure, right? Both that and define that independent variable and later measure that dependent variable. In order to do that, I need to understand which types of variables do I have and what are they usually used for. And later on, how is it that we measure them? Okay, so let's get started. Before I continue, any questions about our previous lecture? Anyway, good deal. Fantastic. All right. All right. So the first thing we are going to talk about is explaining what exactly is a variable, just in general terms. What do we mean by a variable? I like to think about a variable in a very basic sense, which means anything that varies, anything that changes, whether it be from one person to the other, from one situation to the other. So I like to think of it as any value or some sort of characteristic, anything that is going to change, right? So for instance, let's think about anxiety. Anxiety varies, right? Sometimes we have a little bit of anxiety, sometimes we have no anxiety, and sometimes we are having a panic attack, right? Sometimes we have no depression, sometimes we have a little bit of depression, and sometimes we can be, say, for example, thinking about self-harm, SIV, SIHI, right? Self-injurious behavior, suicide ideation, or homicide ideation, right? So notice that that is something that varies, right? So we would categorize that as a variable. And today we're going to get into a little bit more in detail on different types of variables. Generally, when we are referring to a variable, generally, we are doing so in order to make it suitable for scientific study. So I believe in the past, we have talked about, say, for example, defining a term, right? And I think I used the term love, right? So if I asked any person here to define, let's define hate. How about that? Ooh, right, I'm feeling dark today, right? You're very metal. So what is hate to you? What does that mean? So anger and aggression towards a person. What about you, ma'am? What does hate mean to you?
Very strong dislike towards something.
Okay. So we have anger and aggression. We have anger and dislike. Let's see. Anybody else on this side? Yes, ma'am.
Absence of love.
Absence of love. It's basically a dichotomy. So notice that with just 3 people, I have 3 separate definitions that sound pretty different from one another. Would that make it suitable for a scientific study? Probably not, because I have so many variations. So in order for us to have a variable, we define it in order to make it suitable for scientific study. Another interesting characteristic, and remember that social sciences are sciences for a reason, right? Because we are trying to conduct scientific research upon them. A characteristic of a variable is that it must be observable. What is observable? When I say observable, I don't necessarily mean directly observe something. It could be. We can either observe something directly or indirectly. It can be measured directly or indirectly. What does that mean, right? What does it mean to observe something directly? If I were to say, for example, in the definition that we had, what's your last name? Countryman, that's right. So we have Dr. Countryman over here, and she, for her study, defined anger as aggression, right, towards another person. What's aggression, right? Is it yelling at someone? Is it throwing something at them? Is it ignoring them, right? Lack of love, right? If I were to ask any of you, how much does anger weigh? What color is it? Right? What does it smell like? I would assume it smells awful, right? But notice that I cannot observe anger directly. I am unable to observe anger directly. However, I can create measures that can observe anger indirectly. Right? That will happen a lot in our field, in social sciences, because generally the variables that we have are not directly observable. That happens an awful lot. What is depression? What color is depression? How much does it weigh? So because I can't observe something directly, I have to develop a measurement that could be extrapolated and translated into an indirect measurement. Any questions about what's observable? So notice that I don't have to observe it directly, but I can create a measurement that we can extrapolate. Okay, and a hate looks like anger, X, Y, Z, right? We can define that variable. Another characteristic of a variable is that I must be able to replicate. And I must be able to consistently observe it more than in one occasion, more than one time. Why is that? We'll say that I have this new variable, right? Let's say COVID-related social anxiety, right? If I'm only able to observe that one time, am I actually able to replicate? So for example, if I conduct a study like that and I was only able to observe this variable once, then say Dr. Countryman wouldn't be able to replicate my study because she would not be able to observe that variable again, right? So then we have to worry about issues of validity and aspects of that nature. Any questions about that? Fantastic. Good deal. Now, let's move on to our next definition. Because you've heard me use the term construct before, haven't you? Sure, at least one time, probably today, right? So when we are talking about a construct is used to describe what we are observing. It's a concept of a variable that we know it exists, but I cannot directly observe it. Generally, in social sciences, when we're talking about that, specifically, what we're talking about is a behavior or an event that we believe is going to reflect that concept itself, right? So who can tell me what let's see, I always say the first. Who can tell me what a psychotic person looks like? What do they look like generally? Someone who is having a psychotic break. What do they look like generally? Who can tell me? They have bizarre behavior, right? What else? What do we normally see in someone who is actively psychotic? Yes, ma'am. Disorganized, right? Disorganized thoughts. Yes, ma'am. Disassociated. Correct. So notice that I'm defining psychosis as a construct because again, what color is psychosis, right? But I can identify behaviors that we generally align with that word, with that variable, right? So in our field, that's generally what a construct looks like. I don't know exactly what psychosis is in terms of being directly observed, but I can sure tell you about behaviors that are generally associated with that. So for example, what does a panic attack look like? Who can tell me what a panic attack looks like? Yes, ma'am. Hyperventilating. What else? Yes, ma'am.
Generally associated with like sobbing or very intense.
Okay, so sobbing, crying, okay. But what color is a panic attack, right? So notice that we can define a construct based on what is around the construct, but the construct by itself cannot be directly observed. That variable by itself cannot be directly observed. Generally, these definitions will come from a theory, right? And they are generally the central components of a theory. Any questions so far about constructs? Right? So a construct is basically a definition about something I know for a fact exists. I can just simply observe it directly. Now, generally, the external factor of a construct, what that means is that it's something that I can indeed observe. And we presume that that behavior that I am observing reflects that construct specifically. So let's go back to a panic attack, defining it as a construct. We mentioned hyperventilation and we mentioned crying, sobbing, right? That could be that the person just won $1 million. See that? So the same characteristics, same external behaviors, right, could reflect multiple definitions, which is why we need to zero in very specifically when we are defining a construct. The behaviors that are associated with that construct, I want to be as specific as possible. Because if I were to win $1 million, I wouldn't quit teaching, by the way. I'll just probably get like a Maserati or something, just say, hey, something like that. I wouldn't quit teaching though. But if I won $1 million, I probably would start crying and I probably would start hyperventilating, right? Be out of happiness or shock, right? So notice that for a construct to work, it has to be specific to the observable behavior that we are describing. Any questions about that? Fantastic. Another aspect of a construct is the operational definition. Operational definition. What do I mean by that? An operational definition, simply put, it's what operations are we going to conduct to measure or define this external factor that we are trying to observe. So the definitions from the term, right? Operational definition is what operations am I going to conduct that will allow me to measure this construct. So for instance, we define a panic attack as, let's say, a perceived sudden fear, an anxious fear characterized by hyperventilation, crying, avoidance, perhaps disassociation. So notice that I'm getting more in detail. And an operational definition would be, how do I intend to measure the severity of the panic attacks? For example, I can develop a measurement that looks for those symptoms, right? Hyperventilation, crying, dissociation, perhaps. Any questions about an operational construct? Yes, ma'am.
What if you're looking for a panic attack and it doesn't fit those situations in operational definition?
I would argue. So the question was, for those of you watching at home, hey, I see you. So we have a live audience today. What? I would argue, why is this so different? right? So the question was, if that definition does not meet that description, I would argue why not? Because panic attacks have been thoroughly defined, right? So I would argue, is this really a panic attack, or does it fit the criteria for something else, right? So for example, it may just reflect severe anxiety instead of a panic attack, right? So I would argue that first, because it's a construct that is so clearly defined that I would argue, okay, why exactly is it not fitting? And you will see that when you start diagnosing your own clients or patients. You will see that a lot. That you think, this doesn't really sound like a panic attack. Maybe this sounds like something else, right? So you will see that often. I will first ask myself, why is it that it's not fitting? I would ask that first. Does that answer your question? Yeah, thank you. Here are a few examples, right, of operational definitions. Let's see. Let's pick one. Let's see. Which one do you guys want to talk about? We have attraction, have anxiety, we have recall. Which one would you guys like to discuss?
Recall.
Recall. All right. So generally, something that I would like to point out is that generally the definition that we have on a dictionary is not operationalized, right? It's very generic. And in science, we don't use the definition that we would find in a dictionary because we want to be not generic. We want to be as specific as possible so that I can measure it, right? And in this sense, we have the description. We have that definition. So the ability to bring a thought or experience back to mind or memory. And remember, I said that an operational definition, right? I don't know what color is recall. I don't know how much does it weigh. Therefore, I cannot observe recall directly. But what I could do is give it an operational definition so that I can measure behaviors that we commonly associate with recall. So for example, the number of errors in an exam. I could record that, right? Matter of fact, I will record that, right? For you guys, right? How many errors do you make in your exam? The time that it would take for you, for example, to complete a task. So if I teach you how to put together a puzzle, right? How long does it take you to put it back together? Notice that we are providing an operational definition. These behaviors, as you can see, can be associated with recall. But what if I say, for this operational definition, I'm going to say the physical proximity that you have to another person. Does that sound like anything related to recall? How close you sit or stand to someone? Probably not. So notice that that would be a mistake because I'm using a behavior that is not associated with recall. Notice that in this case, this behavior is closely associated to attraction. The chances are the person that's sitting next to you has to at least tolerate you. How about that? At least, right? Maybe you didn't take a shower that day and I'm like, I do not want to be next to this person. So notice that generally the behaviors that we use that we are associated with that construct, they're pretty closely related to it. I wouldn't say recall is how close you sit to someone. That makes very little sense. So any questions about operational definitions? Fantastic. You as a scientist and as a researcher, later on, you will have to do this. You will have to define variables yourself. And generally, you will inform this definition through previous literature, right? Because you're not the first one to define anxiety, right? Somebody already set down, validated that measure, okay? So let's continue with our types of variables. We know what a variable is, and we know how to measure it, I should say. Let's talk about two types of variables. The first one is a continuous variable. As the term suggests, it stands along a continuum. Basically, any place after this decimal point. Because of that, I can measure it with whole units. So for example, 1, 2, 3, or fractional units. I can say third, is, et cetera, et cetera. So I do have that ability. Any questions about a continuous variable? As the term suggests, it stands in a continuum, and it can be measured in a whole sentence or in a fractional sense, I should say. Now, let's talk about a discrete variable. Here, we have a significant difference. It's measured in whole units or categories. And if you remember nothing else, remember this term right here, categories. Why is that? Categories are not generally distributed along a continuum, right? So, for example, think about siblings, right? You have older brother, middle sibling, younger sibling, right? That's not a continuum, right? That is a category, right? It's a unit, right? So because it's a unit, you can't say I had 2.7 brothers. That makes absolutely no sense. And you hear that all the time. The average household in America has 2.3 children. Did they cut the little brother up, right? That makes no sense, right? Because we understand that that is a discrete variable. We cannot, it's not, first of all, it's not in a continuum, and therefore we cannot cut it into fractions. Any questions about that? Fantastic. Now, let's talk about quantitative variables. Quantitative variables. Interesting, a quantitative variable, as the term suggests, right? Definition is in the term. It has to deal with quantity, right? The amount of a variable, right? So definition is in the term. We are talking about quantity. Quantity sounds an awful lot like numbers, correct? So we have a value that is interested in the amount of things. Quantity sounds an awful lot like numbers. And how do we gather numbers? We're usually by counting, isn't it? We usually gather numbers by counting or by conducting a measurement. Interestingly, quantitative variables can either be continuous or discrete. So for example, we have calories. Calories is quantitative because I can literally count how many calories, right? I can count how many calories do I consume, which is more than likely, more than I should. We can all hashtag relatable, am I right? But also, the pieces of food are also quantitative. I could have 1 piece, 2 pieces, 3 pieces, but in this case, it will be considered a discrete variable because this sounds more like a category. I ate chicken, I ate sweet pea, I ate cornbread, right? So that sounds more like a category. Any questions about that? All right. So if quantitative sounds like quantity, like numbers, we can talk about qualitative. Qualitative sounds like what? Like quality, like a characteristic. So we're talking about different classes. Generally, in this specific case, when we are referring to a qualitative variable, we are referring to a category. generally of something that we are observing. And if quantitative means quantity in numbers, that means that qualitative is not. It's interested in describing non-numeric aspects. Because it's a category, right? It deals with categories. That means it can only be discrete. An interesting aspect, for example, I should say, mental disorders are considered qualitative. Why is that? You would say, well, that makes no sense because we can measure depression, right? I can measure if you have a little bit of depression, somewhat depressive, or maybe you're super depressive, right? Clinically significant, right? Clinically depressed. But mental disorders, that's simply, it's a fictitious number. It's a way that we use to understand mental illness because a mental illness is a category. We have mood disorders, we have trauma-related disorders. So notice that these are categories. It's like saying you're pregnant or you're not pregnant. I can say how many people are pregnant, but in saying you're 47.3% pregnant, that makes absolutely no sense. You're either pregnant or not pregnant. You're either going to be a baby daddy or not a baby daddy, right? So that will make no sense to say you're 20% baby daddy. It will make no sense. Either you are or you're not. So notice that that number is to give us an understanding of the category, but the number in it by itself would not be quantitative. Or the mental illness wouldn't be quantitative. Any questions about that? Fantastic. Good deal. Now, we also have scales of measurement. That is a solid line right there. I did pretty good. Look at that. I'm proud of myself. That's a straight line. Look at that. I did good. So the scales of measurement, we have 4 different types of scales. And we're going to cover them in much detail. We have nominal, ordinal, interval, and ratio. Nominal, ordinal, interval, and ratio. These right here. A scale of measurement. It's simply rules that we utilize based on the properties of numbers. And they will all have different usage. So based on the usage, we can say this number is nominal, and this is what I can do with it. This number is ordinal, so this is what I can or cannot do with it, and so on and so forth, right? Because we have those rules of scales of measurement. Now let's cover them a little bit more in detail. Now, a good example would be, the first one that we're going to cover is a nominal scale. It's simply there to represent something or someone. It only involves the representation, okay? That number doesn't give me anything else. It simply tells me this represents something or someone. For example, a zip code, right? So, see if I remember. My vacation home is in this zip code, right? That doesn't tell you anything about my vacation home, does it? It Doesn't tell you if it's good, if it's nice, if it's big, if it's small. It doesn't tell you how old it is. It doesn't tell you absolutely anything other than this zip code represents the location of something. It's a representation of that city, right? So notice that it doesn't give me anything else other than representing something. Now, why is it that we need that in social sciences? Because you're thinking, well, it doesn't really give me a lot of information. It's still needed. Because we're trying to convert something that's a category, and we're trying to give it a numeric value. So for example, I can say I conduct a survey, right, of the 200 something students that I have, and all the males in the study will be giving a code of a 1, and all the females of the study, I can give a number of 2. I would add a third, so like non-binary or non-conforming or something like that. So I will make that a 3. That number doesn't tell me anything else. It just simply tells me a representation. So men, 1 represents men, 2 represents women, and 3 would represent non-binary. Notice it's not telling me if 1 is greater than 2 or 2 is greater than 3 or if 1 came first. It doesn't tell me any of that other than the category that they intend to represent. Okay. Any questions about nominal scales? Fantastic. Good. Now the next level of measurement is an ordinal scale. Notice that it's only going to demonstrate order. It only demonstrates order. It's only going to tell me, so now we have a little bit more of information. So it's not a category per se, but it's giving me a little bit of information because now it's indicating that one rank is going to be greater than the other. So for example, let's say, or my athletes, any athletes here? Anybody? No, we don't have any athletes. What about gamers? Any gamers? All right, there we go. So in a tournament or some sort of competition, you came in first and your buddy came in second and some guy in some other country came in third. Those are ranks. Those are simply telling me that you came in first, the second person came second. It doesn't tell me how good of a gamer you are. It doesn't tell me how many hours you spent playing. It doesn't tell me if you're male, female, if you have depression. It doesn't tell me anything other than you were first in that tournament. This person was second, third, and so on and so forth. It simply tells me a form of rank or order. Any questions about that? Good deal. Fantastic. Let's talk about interval scales. Something immensely important about interval scales is that they really do not have an actual 0. The 0 that they have doesn't necessarily mean nothing, right? 0, we think about 0 as nothing. There's nothing there. But with interval scales, that's not what 0 means. They don't have a true 0. Generally, these scales are equidistant. What does that mean? One number is as far away from the other number as the next number, right? So if I have 10 degrees, 20 degrees, 30, and 40, right? What does it mean to be equidistant? It means that the distance between here and here is the same distance between here and here, right? They're equidistant. That difference will be the same. Good example is temperature. right? So if I have 10 degrees, 20 degrees, 30 degrees, 40 degrees, if I tell you that it's 90 degrees outside, and yesterday was 80 degrees, then you know that that's the same difference in me saying, oh, in the winter it's going to be 20 degrees compared to 10 degrees last year. So you know that that is literally the same difference of 10, right? So that it is equidistant. Any questions about that? Notice that because it doesn't have a true zero, right? And you know that temperature is energy, right? It's heat. It's energy in the form of heat. Saying that the temperature is 0 degrees doesn't really mean that there's no energy in the atmosphere. So it's not a true zero. It's just based on this scale. On this scale specifically, there wasn't a measurement, but it doesn't mean that there was no actual energy. There is energy in the atmosphere. Sorry? Correct. Correct. She mentioned unless it's Kelvin, but Kelvin it is the case. Kelvin does have a true zero, which, following along with that, we are talking about a ratio scale. A ratio scale does indeed have a true zero, where zero really means zero, means nothing. Is the absence of. Similar to the interval scales, you're going to find that in this case, the distance between our measurement, whatever that may be, is also equidistant. The distance between these two is the same distance as these two values. Generally, in this specific case, we consider ratio scales as the most informative of all the scales of measurement. So thinking about your nominal, ordinal, interval, this one, the ratio scale is the one that is going to give us the more bang for a buck, because it does include, a number does mean what it's showing you. It's not a code, it's not a category, it's not a rank, it's actually giving me more information at the time. Any questions about scales of measurement? Before I continue with the next topic, I'm going to show you, I do have right now a video. So for those of you who are watching at home, the name of the channel is A Ph.D. Teaches You. And if you look for this video, Scientific Variables and Types of Measurement, and this link will also be posted on the description below in the YouTube video. This video covers in detail, very much in detail, all of the scales of measurement. So again, PhD Teaches You. You're going to see the video titled Scientific Variables, Scales, and Types of Measurement. It will also be in the description. So if you want an in-depth understanding, if something seemed a little foggy about these scales, this here will cover it much, much more in detail. So I highly welcome you to check that out. For those of you who are over here, you will look into A PhD Teaches You, and it will be this video. This video covers it much, much in detail. So if it's a little foggy, make sure to check that video out. Any questions about the scales of measurement? And again, if you need more help, you will find an in-depth understanding in that video. This was basically a summary, brief overview of what they were. Now this is where the fun begins. We're going to talk about reliability of a measurement. We know now all of the scales that we can use, right? Nominal, ordinal, we know what a variable is. We know how we're going to define this variable as an operational definition. We know what my variable may look like. It may be nominal, it may be ordinal. So now that I have everything straight, that I know what my variable is, we need to worry about reliability. And reliability, people tend to confuse it a lot with validity, but I'm going to make it my work that it's not confused here. Hopefully, I can explain it to you in a way that it makes a lot of sense. Reliability, it's simply, if you take nothing else, it's consistency. It's how much a construct, the values that I have for that variable can be repeated. So I'll give you an example. Say I have a ruler, and I put this ruler and I use it to measure this phone. And this ruler, every time I measure it, it's like, oh, it's 6 inches, right? And then tomorrow, Dr. Harper, did I get it right? Dr. Kate, over here. I don't know why I thought you were Harper. You are Kristen here as the So Dr. Kate over here grabs the same ruler that Dr. Countryman used, and she grabs the same ruler and the same thing, and nothing of this variable has changed. So I measured again, and it's going to be 6 inches. This would be considered a reliable measure because over time, the measurement remained consistent. It remained the same, right? In a test, if someone gives you an assessment, right, and say, this assessment for, let's say, I always use depression. I want to think about something else. Psychosis. All right. So this assessment is to deal with psychosis. If I measure you today with this scale, right, and nothing has changed, next time I do it, it should be consistent. If that measurement is reliable, if that assessment is reliable, I should be able to get consistent results over time or based on different people. So if Dr. Shar does that, Dr. Smith can do it, and he's going to get the same result. So that will make it reliable. There are different types of measures for reliability. One of them is test, retest, reliability. What is that? This is when that measurement remained consistent over 2 different points in time, right? So imagine my little ruler, and I measured it today, and then 2 months from now, nothing changed, and I grabbed the same ruler and the same thing that I was trying to measure, and sure enough, I came up with the same measurement. And I do it a 3rd time, and a 2nd time, and a 3rd time, 4th time, and the measurement would remain the same. That's what we call test, retest, reliability. If I give you guys an assessment, say, for adjustment disorders, right? If I measure you today and nothing has changed, and I measure you 6 months from now, say a year from now, if that assessment was reliable, it would measure adjustment disorder again, because it was reliable. Now, interestingly, we do have an advantage of giving the same test over and over again, because we have the ability to find out and determine the extent in which these items, right? Question number 1, question number 2, question number 3, how replicable or how consistent they are. Maybe, right? Maybe question number 1, let's say it's 100 questions. Question number 1 does seem reliable. Everybody's getting the same consistent result, but say question number 2 is like, that's not really remaining consistent. There is a problem with that specific item. Maybe I want to revise it or just completely get rid of it, right? So in keeping with my ruler, say this ruler can measure from 1 to 10 inches, and every time I measure past 6, it's not consistent. I'll get a 8.9, and the next time I get a 10, and then next time I get a 9. Then that means this ruler is not reliable into measuring past a certain time, right? So I would like to remove those items. I would like to get rid of them. Any questions about test, retest, reliability? Yes, ma'am.
Would it be better than to, if you are testing for a disorder, to test for the disorder, the law lines?
Absolutely. That's part of the things that you will do for a fact. Because say, for example, if you're treating someone, right? And you're treating someone who can give me a mental illness. Anybody, just anybody. ADHD, fantastic. So if I have a measurement for ADHD and I have a patient, right? You guys have a patient and this is the first time they see you. So you want to do an assessment with this person about ADHD. You want to know, now you know that this assessment is reliable, right? It's been tested before, it's gone through statistical procedures. If your treatment is working with this person, you would expect that the next time you retest them, their ADHD symptoms will reflect less in that assessment. So you do want to do that for a fact, because that's a good way to measure whether or not your therapy is working, right? So you do want to do that for sure. A lot of insurance companies also look for it. Like, how do I know he's doing well, right? Any more questions? Now, another method that we use to see if something is reliable is internal consistency. Internal consistency. When we are talking about internal consistency, I want you to think about if multiple items are related to each other, right? If the items that I have in there, the questions that I have in my assessment, the inches that I have in my ruler, do they relate to each other or do they not? What do I mean? Say, for example, you're taking an assessment for social anxiety. That's your measurement. Item number 1 says, I have issues in big crowds. Item number 2 says, I find it hard to make a phone call. Item number 3 says, I like horses. That third item doesn't seem that it will be internally consistent with the rest of the items, does it? That's what internal consistency is. It's trying to see whether or not these multiple items are indeed related to each other. Are they actually, in fact, trying to be related to each other? I mean, for all I know, maybe there is a relationship there that I haven't found out, but that doesn't look like it will have a relationship. I like horses. Okay, right? Is that really related to social anxiety? Right? Now, a way that we can test for internal consistency is through Cronbach's alpha. Has anybody here at least heard about that statistical procedure? Okay, so some people never, some people, okay. It's a statistic that what it intends to do is to split all of the items in every possible way in order to see if there is indeed a relationship between all of them. And I'll give you an example. I'm feeling creative. Let's draw a little bit. What do you guys think? Let's draw. So, let's see. So say, for example, in keeping with this assessment that I'm making up, right, about social anxiety. And let's share the screen. All right. All right. So in that assessment that I was talking about, say question number 1 was having an issue with the big crowds. All right, so let's do that. Number 1 was big crowds, right? Having an issue with big crowds. Number 2 was making a phone call, right? And number 3 was horses. What Cronbach's alpha is going to do is find out, what Cronbach's alpha is going to do is find out if the items are the numeric value, as for example, is this item related to this one? Is this item related to this one? And vice versa, right? It's going to do all possible combinations. So 4 related, item number 1 related to 4, item number 1 related to 5, and so on and so forth. Why is that? Well, because I want to see the relationship, right? I want to see that relationship. Because I can assume if indeed these items are related, then I can say they are measuring what they're trying to measure. So for example, if I run a Cronbach's alpha and the relationship between these two turns out to be 0.70, right? And remember, the closer the number is to 1 or -1, the higher that relationship. This is pretty high, 0.70, right? So that tells me these two are interrelated. There is an internal consistency. But then I run being afraid of big crowds and liking horses, and there's like a 0.1, right? But notice that there is less of a relationship, then they're probably not related at all. It might be even less than that. It would be like a 0.007. So notice that I can say these two are probably internally consistent, but then these two are probably not. So one of them is not consistent. One of them is probably not dealing with social anxiety. Any questions about internal consistency? Yes, ma'am.
How do they come up with the numbers?
So let me Google the statistic very quickly, and I can actually show that to you. Back some. All right. I'm going to share the screen. Too much. All right. Good deal. So, in terms of Cronbach's alpha, we have a formula, right? And luckily, you guys probably don't have to do it manually. Why? Because we got something called computers, right? And luckily, sometimes some universities do require this to run it by hand first, and then learn it in that way. So here, we're trying to find, for example, how equivalent the reliability is, right? So that's when we find our internal consistency. And K represents the number of items. So for example, I said that this example of my fake social anxiety assessment had 100 questions, right? So it would have number of items would be 100. So we replace this for 100. Then you want to find out if there is indeed any covariance, if one of these can influence the other, right? If there's some sort of variability between the items. And similarly, we also want to find the variance within those items. And once we find if there is in fact some sort of relationship, some sort of variance, the higher the number, closer to 1, so +1 or -1, the more likely these items are related to each other. All right, so in the example that I gave about liking horses and not liking big crowds, you're probably going to find that value is a 0.00 something. It's likely not related. That variance that you're finding here and that covariance that you're finding here, it's not likely to be related. Does that make sense? Yeah. Luckily, I don't think in this course specifically, I don't think we're going to run it by hand. I don't know. It depends on my TA. Chun, chun, chun. Oh no, we're going to be biased. Everybody's like, girl, we don't need that, right? You don't need to do that. All right. Just ask. All right. Good deal. Now, let's move on to our next method of reliability. And like I said, the larger the value for that Cronbach's alpha, the higher the internal consistency may be. So if an item is 0.76, you know there's a lot of consistency there. There's a lot of relationship there. But when you do it, it's a 0.2, that's a very modest relationship between the two items. Now, another method that we have that we can utilize for reliability is Interrater reliability. Some people refer to it as inter-observer. I don't like that term personally. I prefer Interrater because I like the idea that somebody is rating the reliability. So I prefer this one, but it's also known as inter-observer. What is this type of reliability specifically? In regards to Interrater reliability, is when two people actually sit down and come into an agreement of whether or not these items are indeed related to each other. Right? Are these items related to each other? Do we come to an agreement that we are indeed trying to measure the same behavior, right? So in the case of social anxiety on my little instrument here, item number one, say, let me pick someone I never picked. I don't think, what's your last name?
Ulloa.
Ulloa? It's a Spanish? Ulloa, I like it. Habla español. Okay. So Dr. Ulloa over here, she and I sit together, and this is the instrument that Dr. Kate came up with for social anxiety. So you and I are going to sit together and read the item, and item number one that Dr. Kate came up with, it's like, I'm afraid of big crowds. Okay, that sounds reasonable, like for someone who has social anxiety. So Dr. Ulloa and I get together and say, okay, that makes sense. Number two, making phone calls. It's very difficult for people with social anxiety to build up that, I don't want to say courage, but that ability to make a phone call. And then we get to item number three, it's like, I like horses. Well, I feel like Dr. Ulloa and I would agree, that doesn't sound like it measures anything remotely related to social anxiety. That's Interrater reliability. So two people or more come together and evaluate, right, that specific test based on the items. Right? Are we in agreement that liking horses is not necessarily related to social anxiety? Now, we do have methods, statistical procedures in order to conduct that rating. Now, the scores that I would give to the assessment, right, to each item, and the scores that say Dr. Ulloa gives to that item, and say, what's your last name, ma'am?
Hello. Hello.
Hello. So say it's Dr. Ulloa, Dr. Malone, and myself, and we're going to get together. Dr. Malone can run a statistic, and we can run the scores and say whether or not they're actually similar. So for example, if I say that eventually when she runs the statistic, it's 0.87, and it is indeed measuring social anxiety, and then Dr. Ulloa, when Dr. Malone runs the statistics and says, I said 0.87, and then with Dr. Ulloa, it came out 0.83, and then with Dr. Smith, it came up as a 0.90. That's pretty close to each other. So it seems like, yes, this instrument, according to the judges, as I like to refer to them, to the rater, it does appear that there is a consistency. Any questions about that? Fantastic, you guys are sweet. Now, this is where people sometimes get confused. Right? We talked about reliability. And if you learn nothing from reliability, is that it remains consistent. Right? Validity, on the other hand, what is validity? Is the extent in which a variable, right, that measurement, that construct, is indeed measuring what it wants to measure, right? So reliability is consistent, right, between people, within items, between different points in time. Is it consistent? Whereas validity is this truly measuring what I said it's going to measure? Is this ruler actually going to measure inches? Is that assessment actually going to measure social anxiety, right? So that's what validity is. Is it truly measuring what I said it's going to measure? And people tend to get these confused very easily. Bless you. Did it feel a little groaning? Did it feel a little groaning? Okay, good deal. Okay, good. Like if you feel a little groaning, like and subscribe, you can watch. Okay. And the comfort of your own home. You're loved though. You're everybody's welcome. Unless you got Roni, and I need you to stay home. Because I don't want your Roni. Having said that, and there you go, that's a good example. Does that cough indeed measure corona? Is it truly intending to measure what it's trying to measure? Is it a valid measure? Maybe not. It's measuring an allergy, right? It's measuring a sinus infection or something like that. Maybe she needs some water. So notice, does that cough, is it valid? Is it a valid measure to measure corona, right? In this case, it doesn't seem like it, right? So the first thing, there's different types of validity, just like we have different types of reliability. The first one is face validity, and I like to think of it, it's really similar to Interrater, in my opinion. Face validity. Face validity is simply at face value. Just looking at an item, looking at something and saying, well, this does look like it measures what it said it's going to measure. So for example, when we're talking about that study, or I should say the assessment that Dr. Kate is developing, so say for example, it's trying to measure social anxiety, and she says, item number 1, it measures, I'm afraid of big crowds. I think all of us could look at it and say, at face value, at face validity, and say, that sounds like something that measures social anxiety. All of us can look at item number 2 and say, I'm afraid of making phone calls. Okay, that looks like it's something that's related to social anxiety. But then all of us look at item number 3 and say, I like horses. That does not look like it can indeed, it has nothing or anything to do, I should say, with social anxiety. That is what face value is. It's quite literally looking at an item and saying, that doesn't sound right. That doesn't sound like it's actually measuring what I said I was going to measure. It's generally a preliminary step, right? So Dr. Kate would sit with her colleagues, supervisors, statisticians, or herself, and we would all discuss this assessment and say, I don't think you liking horses has anything to do with anxiety. Oh, but I deal with horses and it makes me feel better. Doesn't really fit any criteria for social anxiety though, right? So we would agree that it probably doesn't have any face value, right? Generally, you will get that consensus from your peers. So any questions about face validity? All right, good deal. Let's move on. Construct validity. We talked a little bit about constructs before. When we are talking about construct validity, we're trying to find out what is the extent that that operational definition is indeed related to your variable, right? So think about our previous example, and I'm going to go back a little bit. Right, let me go back a little bit. All right. So here we have recall, right? And a construct validity would be, well, I have one criterion, right? In order to measure recall, but construct validity is trying to find out, okay, generally something that's one-dimensional won't help you define that. And what do I mean? This is just one dimension to measure recall, right? The number of errors made on an exam. You could have made that error because you had anxiety and it had nothing to do with your recall, right? So notice that in this case, just having one dimension did not really help you, did it, to define and to measure that? Because sure, it can mean recall, but it can mean anxiety. Not being able, the numbers of errors you made on the exam could mean that I created an exam that was faulty because you made a lot of mistakes, right? So really it wasn't you, it was on my end, right? So notice that that construct wasn't measuring recall. It could have been measuring anxiety. It could have been measuring my ability to teach. It could have been measuring my ability to grade. So just having one characteristic, it won't really help you when it comes to that type of validity. Because again, is it really measuring recall? Is it measuring anxiety? Right? Like the measurement that I gave, the example that I gave earlier, I should say, we talked about anxiety as hyperventilation and crying. Well, I would start hyperventilating and crying if I won $1 million. So is it really measuring a panic attack, or is it measuring my happiness of being a millionaire? All right, so that wouldn't be a particularly good measure for construct validity. Any questions about that? Fantastic. You guys are great. Now, interestingly, we also have another method of determining validity. Is something measuring what it said is going to measure? And that is content. When we're talking about content, it seems like the content of that assessment does represent all of those features, right? So here we have a panic attack, we have hyperventilation, we have disassociation, we have crying, we have avoidance, we have fear of the future, we have a sense of losing control. Notice that now I'm being so specific that the content, this content specifically, it does sound very soundly, for lack of a better term, that it is indeed measuring what I said it was going to measure. Now, because I'm being so specific and not just saying crying and hyperventilation, because this content is much more specific that I can provide a rationale and say this in fact is the appropriate content to measure this construct, to measure the behaviors or features that I'm trying to measure. The more thorough that measurement is for the construct, the higher that construct validity. So if I say a panic attack looks like hyperventilation, it looks like crying, disassociation, fear, avoidance, escaping, lack of control, thinking you're going to die, the higher that measurement, the more likely that I'm being valid in that measurement. So any questions about that? Good deal. Fantastic. Right, this one over here, it's a little wonky, but nevertheless, here we go. So we have criterion-related validity. And what do I mean by that? It just examines the relationship between that measure. Yes, ma'am. 5 minutes. So in this case, a criterion, what we're trying to do is that we're going to examine that relationship of the scores and some other criterion. So for example, what does that mean, right? It sounds like a really confusing definition, but nonetheless, here's Dr. Shaw. I would assume, right, that the criteria of that definition of social anxiety would be related to the other criterion of anxiety. I can say that prejudice could be related to discrimination. So I would expect if you're having a lot of social anxiety and I give you an assessment for social anxiety, I could expect that that score is going to be similar to one for anxiety, right? Because these are two criteria, these are two aspects that are related indeed to one another. But in the instrument that Dr. Kate created, say, okay, she created, we did face validity, we did everything. But then we take that assessment that she invented of social anxiety, and then I have the same person doing a anxiety assessment, and it turns out that person scored really high on social, but then not in general anxiety. That's bizarre. That's when one criterion is not matching the other. That's a problem, because now what is actually being measured with Dr. Kate's assessment? Apparently not something related to anxiety, right? So notice that that will be a problem. Any questions about criterion-related validity? Right, so we're trying to compare it to something that we believe would indeed be related to, right? So if you're measuring depression, in terms of depression, we can try and look into another mood disorder, right? Generally, one mood disorder is related to another. So if I give you an assessment for depression, say for example, the Beck Anxiety Inventory, which has been validated, and Dr. Kate is creating a new assessment for depression, I would think that your assessment that you created would be related to the Beck Anxiety Inventory. I would think that if the same person takes both, it would be related to one another. Any questions about that? All right, that's going to be the end of our lecture for today. And we are going to continue next time on aspects that could indeed affect our measurement. And thank you very much for your attention.
So is our test finished back?
Yes. Okay. Because I'm not done with chapter 4. So, yay. Oh man, wow.